With October being Breast Cancer Awareness Month, here are details on a new way for patients and caregivers to get the tools that they need. Well, according to the American Cancer Society, 1 in 8 women will likely develop breast cancer. What if you're that person or someone you love? Well, how can you become your own best advocate during this challenging time? Joining me to discuss is breast cancer specialist Dr. John Williams. Dr. Williams, thanks for joining me.
Thank you for having me, Alex.
So you recently launched the Breast Cancer School for Patients. Describe a little bit of what it is and what the inspiration was behind it.
Well, this is a school for everyone. It's free. It's information online to teach women in video format everything they need to know through one website, the Breast Cancer School for Patients. There's something missing online about breast cancer information or even health information. It's just hard to understand. So that's why we condensed everything into video content and on one site.
Well, that's certainly what distinguishes it from a lot of those other websites. It's having those videos that are easily accessible, easy to understand. This sounds a lot like telemedicine. Is this a trend that you see is growing?
I think this is really sort of a form of telemedicine that's free that you bring into your home about breast cancer. Normally telemedicine is one hospital or talking to a facility or someone, hospital. But this way, if you want to learn about 3D mammograms, should I get one? Or when to start mammograms? You in your own home can watch a video, learn everything you need to know, share it with your partner or family, and also have links to the best content online to learn even more detailed information. So yes, it's a neat, free form of telemedicine.
And something I mentioned in my introduction was self-advocacy. Speak to the importance of being your own best advocate in situations like this.
Self-advocacy essentially is, number one, being informed. And that's why we created the Breast Cancer School for Patients. And number two, engaging your physicians in this case, or your breast specialist. So if you have cancer, you're well informed, you engage your physician, asking them questions, developing a relationship. Together, you will make better informed decisions, and you will not only get higher quality cancer care because you're working together as a team, but you'll be more pleased with the outcomes.
Now, in terms of numbers and people affected by breast cancer, do you see one group more at risk, being affected more often than another?
It's interesting. Statistics show that as you get older, a woman in her 70s has a higher chance of getting breast cancer in a particular year than a woman in her 30s. It's less common when you're younger. But what offsets that is that women, younger women, the younger you are, in general, the cancers that you develop are more threatening and also more aggressive. So we're seeing breast cancer, still 1 in 8. We're doing better at curing it, and some good studies have supported that fact. But I think it's so important to make sure that you, as an individual and a woman, get the best care by educating yourself.
Dr. Williams, this is just a glimpse into the future of medicine. I think it's super important to make it accessible, make it easy for people to get the information that they need. And like you said, it's so important to be your own best advocate. So, Dr. Williams, thanks for your time today.
Have a great time, and thank you for having me.
Of course. Stay where you are. We'll be right back.